It's now my privilege to introduce Dee Ives, who's an Air Force veteran and a nurse.
Thanks, Dee.
Hello, everyone. I can tell you that we could hear you all the way up in the hearing room on the 4th floor. My name is Dee Ives, and I'm a veteran of the United States Air Force. I became a nurse in the 1990s to help serve my fellow veterans during the nursing shortages we were having at our veterans' homes at those times. I am also proud to say that I work at the historic Wisconsin Veterans Home at King, Wisconsin. I've been there 13 years and work with the most awesome people that you can even imagine. 10% of our staff are veterans in their own rights. And I am here to ask our legislators to please pause and consider the serious implications of harm that passing this bill will have on our ability to give quality care to the veterans of the state of Wisconsin. The Wisconsin Veterans Home in King was established over 120 years ago by the citizens of the great state of Wisconsin in order to provide a community for their Civil War veterans to spend their final years with dignity. I am also a Reagan Republican. This bill should not be about party politics, people. I am also a proud member as a union veteran of SEIU, Healthcare Wisconsin, and the Wisconsin representative of SEIU International's GOP Advisory Committee. We are urging our legislators on both sides of the political parties to please slow this down. Look at the implications for the people that have trusted you to provide them the great service for the service that they provided for our country. They will come to serious harm if this bill is passed, because we will have an exodus of that dedicated staff. They will have to leave to go if we do not have the right to negotiate for safe hours, if we do not have the right to negotiate for having our days off, for having the ability to talk to our legislators, to tell them what needs to be done to help our veterans, our staff is going to have to leave to private sector jobs. It's going to pay them more and will not mandate them the excessive overtime that we have experienced over there. So, again, I thank each and every one of you for coming, and I'm asking our legislators, both Republican, Democrat, and Independent, to please pause and do not pass this bill because it will hurt your veterans.
I'm a registered nurse at the Ridgewood Healthcare Center in Racine. Right on, Racine! Ridgewood is a nursing home owned and operated by Racine County. Our registered nurses are proud union members of the Racine County Federation of Nurses, Local 5039. We are members beneficent Federation of Nurses and Health Professionals affiliated with the American Federation of Teachers, AFL-CIO. I have the distinct honor of introducing myself to you as the president of Local 5039. I'll tell you a little bit about myself. I am a single parent raising a young son, and collective bargaining has made it possible for me to have health care coverage and be there for my only child. But now, our workers' rights are threatened. If Governor Walker's bill to end collective bargaining rights is passed, I won't have trouble over increased health care premiums because I will no longer receive health care. Boom! Registered nurses in Racine County will be providing quality health care to patients, yet cut off from our own health insurance for us and our families. Whoa! This will affect the lives of all nurses at Ridgewood Healthcare Center. Many nurses will be forced to look elsewhere for new jobs. And we all know jobs are very scarce these days. Without collective bargaining, the nurses that are left behind will have no say over working conditions, schedules, staffing, or healthcare policy and procedure. Wages will be decreased and benefits will be lost. But the nurses are not the only ones who feel this effect. The patients will suffer as well. The governor's bill will assuredly impact the nurses' capacity to deliver safe patient care. Patients will suffer. Forcing large cuts to vital public service such as education, healthcare, and law enforcement is irresponsible. Neglecting the needs of our students, families, and communities is irresponsible. We agree that a solution is necessary to balance the budget reasonably. In 2009, Racine County employees came together, faced the budget crisis, and worked as a team with our county executive. The registered nurses stepped out as early leaders to accept a wage freeze during uncertain economic times. We understood what we were up against. Other bargaining units followed suit, and we accepted the wage freeze as well. In return, there were no layoffs. We all kept working when unemployment was soaring. We sacrificed and gave back. We ended 2009 with a $2.4 million surplus in our county. We then negotiated new contracts and ended 2010 with a $700,000 surplus or better. This is what happens when you open discussion. We worked together and found common ground. We were successful. We found a solution. Ignoring our voices doesn't solve the budget crisis, Governor. The financial situation in this state is being used to take away workers' rights. This is not about taxes and budget cuts. It is about busting unions! All union members across the state have given time and time again. We have taken cuts and wage freezes. We went along every step of the way to help balance the budget and keep people working. And now you take away our rights and try to bust our unions! Governor Walker, do you think you are going to balance the budget and pay off debts by busting the unions that provide vital services to keep our communities running? families. Governor Walker, changes are necessary. Ending collective bargaining is not. You talk about ending collective bargaining to prevent layoffs, but Governor, more jobs will be lost. This will not strengthen the economy and rebuild the middle class.
Hell no, we won't go. Hell no.
Tax the rich. This will only damage an already fragile economy. Do not speak of creating jobs in the same sentence when you speak of this bill. It is not okay to slash budgets at the expense of all middle-class workers. The right to negotiate wages and benefits is a fundamental part to the middle class. Ending collective bargaining will not create jobs. This is an assault on the middle class workers. This is not a repair bill. It is a destruction bill on a fast track. This is all being done at a dangerous speed with almost no public input, discussion, or debate. Governor, I can't get in to see a doctor as fast as you can introduce this bill